Riverbend.
Here, here. Mr. Speaker, we now have 2 confirmed cases of the coronavirus in Canada. There's still justifiable reason to be concerned about the current measures in place. Health officials stated that there's a likelihood of other cases in Canada. Respectfully, to the Minister, what is the plan knowing that more cases are likely, and how can Canadians be assured that this spread is being properly contained?
Minister of Health.
Well, thank you very much, Mr. Speaker, and I will say that the risk to Canadians remains low. Our systems continue to work extremely closely together and collaborate, which allows us to quickly identify people who have the virus and treat them appropriately. We'll continue to monitor the situation and add resources as necessary. Thank you, Mr. Speaker.
Member for Edmonton Riverbend.
Mr. Speaker, the National Emergency Antiviral Stockpile was created to ensure that antivirals can be accessed quickly in response to an influenza pandemic. Canadians need to be sure that the government is maintaining enough antiviral drugs to treat people and keep more people from getting sick. Can the Health Minister confirm that there's enough antiviral drugs in the National Emergency Stockpile to address a possible broader outbreak?
The National Health Minister.
Thank you, Mr. Speaker, and I thank the member for his excellent question. In fact, there isn't a particular antiviral developed for this coronavirus, as it is relatively new. But I can tell you that Canada's research community is working closely with our international partners. The fact that we have a copy of the live virus allows us to continue that research, and our labs are well prepared to be part of the international solution to finding immunization. Thank you.
The Honourable Member for Richmond North Athabasca. Mr. Speaker, as my colleague mentioned a few moments ago, we learned this morning that Canada has a second case of coronavirus. People are increasingly worried. The government must act quickly. Mr. Speaker, can the Prime Minister tell us what the plan is to ensure that Canadians are protected from this new virus? The Honourable Minister of Health. Thank you, Mr. Speaker. Ontario has identified a second case of coronavirus in Toronto. The second person is a member of the family of the person in the first case. Both are isolated and are receiving care. We are fighting against this virus in Canada, and the risk of an outbreak in the country remains low. Thank you, Mr. Speaker. The Honourable Member for Richmond North Athabasca. Mr. Speaker, the Minister of Health herself mentioned that there could be other cases identified in Canada. Since this is clearly both a federal and provincial matter, can the Prime Minister tell us what steps have been taken with all provinces, including Quebec, in order to prepare to face the coronavirus? The Honourable Minister of Health. Mr. Speaker, I will reiterate that the risk of an outbreak is low. We are collaborating with our partners,
our international and our provincial and territorial partners, to make sure that we track the spread of the disease, that we identify individuals who are at risk of contracting the disease, who are positive for the disease, and we will continue to do those efforts diligently to make sure that we contain the spread within Canada and that we take appropriate measures internationally with our partners. Thank you, Mr. Speaker.
Number 4, Cariboo-Prince George.
Mr. Speaker, every day thousands of passengers from China and Asia arrive at our ports of entry, Vancouver, Montreal, Toronto. Oftentimes they board domestic flights and connect throughout Canada and North America. Calling the coronavirus a grave situation, China has quarantined whole cities and millions of people. The WHO has now listed the global threat as high. The safety of Canadians is currently dependent upon screening in China and the infected passengers self-reporting. Mr. Speaker, when will the government institute a real plan that includes enhanced screening process?
The Honourable Minister of Health.
Thank you, Mr. Speaker. In fact, our government has been well ahead of the World Health Organization's strategies in terms of screenings at ports of entry. We have multiple measures to alert travelers from the affected regions about what to do if they suspect that they have the illness. We have trained our CBSA officers to ensure that they have the tools they need to support people who may be ill, and we have worked with partner airlines to ensure that there's information on flights. We will continue to monitor the situation and add additional measures as necessary. Thank you, Mr. Speaker.
The Honourable Member for Aurora, Oak Ridge's Richmond Hill.
On December 31st, China alerted the World Health Organization to several cases of pneumonia. And then on January 7th, the WHO announced that they had identified a new virus, coronavirus, originating in Wuhan, China. Days later, China announced its first death from the virus. As of yesterday, the death toll has risen to 81, with almost 2,800 cases confirmed, and Beijing has quarantined more than 50 million people. Mr. Speaker, of the 50 million people in quarantine, how many are Canadian, and what is this Prime Minister doing to bring them home?
The Honourable Minister of Health.
Well, thank you very much, Mr. Speaker, and this is an opportune time to remind Canadians to register with the Global Affairs Canada website to let people know when they're leaving the country. Having said that, I'm working very closely with my ministerial counterparts and our international counterparts to make sure that Canadians who are abroad in the affected areas have the resources they know to get the support from our country to return. We'll have more information as the situation evolves, and I commit to all Canadians to complete transparency. Thank you very much.
L'Honourable